Subclinical hyperthyroidism. What to do about conflicting opinions. Imagine a situation where your blood tests show your thyroid-stimulating hormone levels are low, but your thyroid hormones are normal. This is what we call subclinical hyperthyroidism. It can be tricky because doctors often have different opinions on how to handle it. Some say watch and wait, while others recommend treatment right away. So, what's the real story? Let's break it down. Subclinical hyperthyroidism happens when the brain signals the thyroid to slow down or speed up, but the thyroid hormones stay within normal ranges. The key marker is a low or indetectable level of thyroid-stimulating hormone, or TSH. There are two types, one where TSH is mildly suppressed, between 0.1 and 0.4 milli-international units per liter, and another where TSH is less than 0.1. Often, people don't notice symptoms, which makes deciding what to do more complex. The first step in managing this condition is confirming the diagnosis. Doctors usually repeat thyroid tests over 1 to 3 months to make sure the low TSH isn't just a temporary change. They also look for the cause, like Graves' disease, toxic multinodular goiter, or autonomous nodules. It's important to evaluate if there are any risks, such as heart problems or bone loss, especially in certain groups. Here's where opinions diverge. Many cases, especially mild ones or those linked to Graves' disease, tend to resolve on their own. About half of these cases improve without treatment. That's why some doctors prefer to monitor the patient closely rather than start medication immediately. On the other hand, older adults over 65 or those with TSH levels below 0.1 are often at higher risk for complications like irregular heartbeats, strokes, or fractures. For these individuals, treatment might be recommended to prevent future health issues. Treatment options include antithyroid medications, radioactive iodine, or even surgery, depending on the cause and severity. But it's always a personalized decision. Factors like age, symptoms, underlying cause, and patient preferences all play a role. For example, a young person with no symptoms and mild TSH suppression might just need regular checkups, while an older person with significant TSH suppression might benefit from treatment. The controversy mainly stems from the natural course of the condition. Some people will improve without intervention, while others are at risk for serious complications. The key is careful assessment. Guidelines from different health organizations suggest a balanced approach. Confirm the diagnosis, evaluate risk factors, and tailor the plan to each individual. Close monitoring is essential for those not immediately treated, so any changes can be caught early. In the end, managing subclinical hyperthyroidism isn't a one-size-fits-all situation. It requires thoughtful consideration of the person's age, health, and preferences. Always consult with a healthcare professional who can interpret your specific situation and guide you through the best options. Remember, understanding your thyroid health is a journey, and expert advice helps ensure you make the safest choices.